is lateral aspect medial force. So supporting the lower leg at 0 shouldn't have any movement. That's a really stable knee position. The knee is not meant to bend that direction. So we're looking at the joint line to see if it opens up like that, right? It's just a hinge joint with a little bit of rotation, and I'm putting that valgus force on it. So hence the name, valgus stress test for the what structure? MCL, medial collateral ligament. So I do it at 0, and then it gets a little harder and a little funky when we bend the knee a little bit. So you're gonna see more movement here in the joint by bending the knee to about 20 degrees or so. And then we're again looking at joint line, and this would be maybe after palpation and feeling some point tenderness, knowing the mechanism of injury, some contact maybe from that lateral aspect. So taking all of our hop into consideration as we're doing our special test, and I'm just applying that. Sometimes I go between 30 and then I straighten that a little bit and get all the way here. So that's valgus. And then I come over here, okay, and then support with my right above the joint, and then I apply the lateral force in the medial aspect of the femur. It's kind of just above the joint line. And 0 for the capsule and the ligaments. And again, I'm looking, the knee again does not have that type of movement. It doesn't open up like that. Better not. If it does, you're in trouble. So at 0, and then I bend the knee, and she's obviously nice and stable. That's the the Varus stress test for the what ligament?
LCL.
Lateral collateral ligament. Scoot up just a little bit on the table. And remember, when they're relaxed, nice and lax. See that patella? I can mobilize it, right? Tighten up. Now I can't. All right, bend the knee. Now I can't. So they have to be extended and relaxed for you to mobilize or move the patella. So what's patella apprehension? Patella apprehension, which direction does the patella want to dislocate? Medial or lateral?
Lateral.
Lateral, usually lateral. So that's all you're trying to replicate is the mechanism of injury. Okay? If they felt 2 pops in their knee, that would indicate what? What's that a symptom of? They report it. Symptom of what?
Subluxation.
Subluxation. Pop, pop. Spontaneous reduction. So if that happened, this might bother them as we just push that patella laterally. The problem is right where my finger is, that's right where the patellofemoral ligament is. So they might even have point tenderness on that patellofemoral ligament or in the retinaculum there that kind of helps hold it in the groove. Okay, so it could be point tenderness here, but it could also be the fact that you're just stretching that structure that's torn. Either way, it's a positive sign. Okay, what's apprehension? What's that mean? It means when I do that, she's probably going to tighten up, right? So she'll. It's not like she's going to throw a forceful contraction, but she won't like it. She'll be apprehensive and might elicit a muscle contraction to prevent that patella from coming out of place. Okay, so that's patellar apprehension. Patella grind is same thing. We want to mobilize the patella, remove it. Superior aspect of it, right where that quadriceps tendon is, with the C-shaped cup right above it, and push down. That right away might even elicit pain. But before I even do that, sometimes I'll have them contract, squeeze, relax. So I know they know what I'm talking about, because that's exactly what I want to do. Squeeze. See, she doesn't want to squeeze. There she goes. Okay, some people will be even apprehensive. That can hurt people, right? False positive I talked about. False positive, meaning that caused pain. I'm saying it's a positive test because it caused pain, but again, does that reproduce the pain or the symptoms that's the chief complaint that they're complaining about? Or does that just hurt? Some of you might do that today, and you do it and you contract and you're like, ow! Right? I might hear some ows in a minute, okay? So you're not putting a ton of force. You can feel how much I'm pushing down. I don't know, 10 pounds, something like that, contract. Okay, does it reproduce the pain or not? And then Godfrey's would be bend your knees to 90 for me, put your feet down. And then the best here, you gotta make sure that she's relaxed. So I'm supporting and try to make sure that her hamstrings are off. Most importantly, remember we talked about it, those quads come around, tendon inserts onto the tibia. So if these are tight, it's going to help pull the tibia anteriorly, and we don't want that. We're looking for the posterior sag. So this would only be positive for a ruptured PCL, not a sprain, not a a grade 1 or grade 2. Grade 3, you might see a sag. So we get down eye level. That's kind of where your pictures need to be, and we're looking for that tibial tuberosity, and where is it in relation to the patella here, okay, or the inferior aspect of it. So is this tibia posterior? Do you see that sag or not? So you might have to kind of hold their legs together, because again, if you are truly relaxed, relax as much as you can. Turn your hips off. Right? See what happens? That's going to happen if she's truly relaxed. Right? That's really what's going to happen. So sometimes I can get a Gatorade cooler under here to support. That way my other hands can kind of keep her here. We want them as relaxed as possible. It's not the best test. What's a better test for the PCL?
Posterior.
Posterior drawer is.